Sleep apnea remains one of the most underdiagnosed conditions in medicine, with estimates suggesting that 80% of moderate to severe cases go unrecognized. This is troubling any time of year, but during winter months, undiagnosed sleep apnea transforms from a chronic health problem into an acute cardiovascular threat. The interaction between sleep apnea and cold weather creates a multiplicative risk that helps explain why certain individuals experience strokes seemingly out of nowhere during winter nights. Let's talk about what sleep apnea does to your cardiovascular system every single night. The hallmark of obstructive sleep apnea is repeated collapse of the upper airway during sleep, blocking airflow despite continued breathing effort. Each time this happens, oxygen levels in your blood drop. Your body responds with an arousal, a brief awakening that you typically don't remember, accompanied by a massive surge of stress hormones and blood pressure. This cycle can repeat hundreds of times per night. Imagine your blood pressure spiking dramatically, sometimes to stroke-level pressures, hundreds of times while you're trying to sleep. The cumulative cardiovascular stress is enormous. Winter amplifies these effects through several mechanisms. Cold weather increases nasal congestion and airway resistance even in healthy people. For someone with sleep apnea, where the airway is already compromised, this additional resistance worsens the breathing obstruction. The apnea episodes may become longer and more severe in winter. Additionally, people tend to sleep in warmer, drier indoor environments during winter, which can irritate airways and worsen inflammation, again increasing obstruction. But here's where it becomes truly dangerous. We've discussed how cold weather makes blood thicker and more prone to clotting. We've talked about winter's elevation in blood pressure. These changes occur during the day, but they persist at night. Someone with sleep apnea already experiences hundreds of blood pressure surges nightly. In winter, those surges are occurring in blood that's hypercoagulable, in a person whose baseline blood pressure is elevated from cold exposure. Research shows that winter stroke risk increases by about 20% in the general population, but in people with undiagnosed sleep apnea, the increase is closer to 60%. This isn't additive, it's multiplicative. The symptoms of sleep apnea are often dismissed or attributed to other causes. Loud snoring, witnessed breathing pauses during sleep, gasping or choking sensations, waking unrefreshed, daytime fatigue, morning headaches, these are the classic signs. But many people, especially those sleeping alone, don't know they snore or stop breathing. The fatigue gets blamed on age or stress. The morning headaches are attributed to everything except the real cause. Meanwhile, the cardiovascular damage accumulates night after night. Treatment makes a dramatic difference. Continuous positive airway pressure therapy, CPAP, is the gold standard treatment. It works by providing pressurized air that keeps the airway open throughout the night. The cardiovascular benefits are remarkable. Blood pressure decreases, often significantly. The repetitive oxygen desaturations stop. Stroke risk drops substantially. But here's the problem. CPAP adherence is notoriously poor, with roughly 50% of patients abandoning therapy within the first year. Winter presents specific challenges. The heated humidification in CPAP masks can feel uncomfortable in already heated bedrooms. The mask can feel claustrophobic when you're bundled under heavy blankets. If you suspect sleep apnea, winter is actually an ideal time to pursue diagnosis and treatment because that's when the condition poses its highest risk. Home sleep testing has made diagnosis more accessible and convenient than ever. For those already diagnosed but struggling with CPAP, working with a sleep medicine specialist to optimize the setup, trying different mask styles, adjusting humidity settings, these efforts are worth it. Alternative treatments exist for those who truly cannot tolerate CPAP, including oral appliances and positional therapy for certain types of apnea. The key message is that sleep apnea isn't just about sleep quality or daytime fatigue. It's a cardiovascular time bomb, and winter is when it's most likely to explode.